If you see the data in the last 5-6 months, particularly there is a small spike in month of May. Then from the, last September, we are getting frequently some cases every week or 10 days. So last in November, we had about 11 cases reported. So it is not, it has not gone away and it is not returning. It is there. We are getting some cases. And this month, we have reported only 5 cases. So it is not abnormal. There is not a big dull period so that we can say that it has returned. There is no, it has not gone away. As far as COVID surveillance is concerned, because there is increasing trend all over India, and as you know, 5 states are contributing more than 95% cases. That includes Kerala, Maharashtra, Karnataka, Tamil Nadu, Goa. These states are contributing heavily to the total national growth in COVID cases and in active cases. Of course, yes, we have to take into consideration again the world over, some of the countries are also showing rise. So we have to remain alert regarding a rising trend. It has not been reported here. In the previous waves, we have seen that we are around some weeks later this happens in Odisha. Suppose there is a growth in Kerala or Maharashtra in southern India, we get it a little bit late. So we are watchful, keeping a watch on the situation. It is not yet alarming. We have issued advisory to the district to increase their surveillance, particularly do testing as per the last ICMR guideline of the symptomatic cases. And we are running fever clinics so that those who come, because now it is reported that most of these cases are now coming like mild flu-like symptoms. So these patients should be tested, again particularly those elderly people with comorbid conditions. Whatever death has been reported in last few days are mostly elderly people and comorbid conditions. So they are most vulnerable group. So watch has to be kept with these group of people. The elderly with other diseases that are coming to the hospital with flu-like symptoms should be tested. We have sensitized the districts. We have asked them to increase the surveillance of ILI and SARI and keep a watch over the situation and take steps as it felt necessary. Those who are positive are being sent for whole genome sequencing. We have given a close watch and we will take steps as per necessity.
So New Year is coming, so how you will prepare for that?
You see, there is even all over India there is no restriction. The social restriction is there. So people will gather, have a normal lifestyle, but of course, yes, we will request the elderly people not to go out, remain inside, and those even with symptoms of cold or cough should not go to gatherings. They should remain isolated in their house.